It's HIMSS 2019 here from Orlando, Florida, as this is CommonWell TV. Scott Adams with you as we continue to introduce you to some of our CommonWell Alliance members. It's time now to hear from Neil Simon, who is the Chief Operating Officer of Aprima, an EMD's company. As how is health IT interoperability really involved since joining CommonWell, and how do you see it evolving over the next several years?
Well, it's definitely a lot more prevalent than it ever was before. When we first started, it was just kind of a pilot phase, and now we see it really happening every day in patients' care. I think over the next couple of years, it will become more prevalent. It's something everyone's expecting and used to, and they're going to expect that their records will be accessible to any provider that they see.
Neil, how are CommonWell interoperability services changing the way provider clients coordinate and deliver data?
Well, especially for new patients, it's really important because that patient shows up, especially if you're a specialist, they don't know anything about those records. Now they can download those from another CommonWell member, have access to those patient charts, have access to the x-rays, lab results, various things about that patient before they see that patient. And that makes a big difference in how they can prepare and the information they have about that patient.
Why is interoperability so important to your organization?
Interoperability is important because most of our customers are smaller providers, and therefore it's very important they're part of the community. No more do you just see one doctor that does all your care. There's a variety of doctors that you have to see to treat all your various conditions. And so by them working together through CommonWell and exchanging information, it allows you not have to enter information multiple times or duplicate information, and make sure they have the most accurate and up-to-date information.
Improving patient outcomes, that's such a huge thing. So how does interoperability in your eyes really change the game for them?
Well, it really allows you to see how that patient's progressed over time, to make sure that they're improving and to make sure that they feel like the treatment's working for them. And that makes a big difference to the patients. They can make sure that they're seeing the benefit. In the end, that's what we really care about, is patients seeing the benefit of their treatment.
Aprima, an EMD's company, and you can learn more on them if you log on to CommonWellHealthAlliance.com. As Neil Simon. Thanks so much, Neil.
Thank you very much.